Hello, I am Dr. Kim Krug, and I'm one of the clinicians at the Animal Behavior Clinic here in Portland, Oregon. In addition to seeing behavior cases, I work at a variety of general practice in emergency clinics as a relief veterinarian. Due to COVID-19, most clinics have converted to curbside service and are requiring that their staff members wear face masks at all times. While I was working an emergency shift last weekend, I was quickly reminded how much our appearance can affect patient comfort within the clinic setting. As we move forward through these uncertain times, there are some things that we can do as pet owners to help our pets feel more comfortable, especially if they need to go into the clinic. I would begin by acclimating your pet to the sight of a face mask. Start by showing them the mask and then offering them something yummy to eat. By pairing the stimulus or the mask with something delicious, we can start to create a positive emotional response to the sight of the mask. When your pet is excited when they see the mask in anticipation that they're going to get something delicious, you're ready to move on to the next step, which is putting the mask on your face. Once you put the mask on your face and you just start doing normal things around the house, your pets will start to habituate to seeing you in the mask and they will be less concerned about it. This doesn't necessarily mean it's going to translate into a stranger wearing a mask, but it's the best that we can do while remaining socially distant. If you don't have a face mask at home, that's okay. You can use a bandana or a scarf. It's not about a specific product. It's just about teaching our pets to navigate a world in which they can't see our faces. The other thing to think about is that we want this to be a positive experience for our pets, and so we really need to evaluate their emotional state as we move through this training. At the Animal Behavior Clinic, we often talk about 3 emotional zones: green, yellow, and red. Green is when your pet is cool, calm, collected, and not worried about what's going on around them. Red is when they are over threshold. This is when we may see escape behaviors, we might see barking, lunging, growling, or even biting. Yellow is that transition between green and red. It's when your pet is aware of a change in the environment, and from that point it can either escalate up into the red zone or de-escalate down into the green zone. When we're introducing a new stimulus, like a face mask, the ideal goal is to keep our pets in the green and the yellow zone at all times. This is when the best learning is going to happen and when they are likely to learn what we want them to learn. We don't want to induce fear or anxiety as we start to introduce something new to them. So keep a close eye on your pet's body language and their emotional state as you move through these exercises. Some other signs that your pet is not comfortable can include some of the following: lip licking, yawning, their ears may be back or pulled really tight towards their head. You may see a hunched posture, a tucked tail, again, escape or avoidance behaviors, and we may see things all the way up to the growling, barking, lunging, or potentially biting. The other thing to be aware of as you start thinking about how to help your pets is, how does your pet normally respond when they go to the vet? If your pet shows signs of fear and anxiety when they go to the vet normally, they are candidates for receiving some pre-visit medication support to help treat their fear and anxiety. If we don't treat this fear and anxiety, it is likely to escalate over time. This becomes even more important during a time when owners are not able to accompany their pets into the clinic and when everybody in the clinic is wearing something scary on their face. So if you think your pet may benefit from pre-visit medication support, reach out and discuss this with your primary care vet team. If you have other questions about your pet's behavior or you're interested in a consultation to discuss behavior concerns, please feel free to reach out to us at the Animal Behavior Clinic. We are currently able to offer telemedicine consultations to pets all over the country. We continue to offer vet-to-vet consults where your primary care vet consults with one of our clinicians on your pet's case. We have 3 amazing trainers, Stephanie, Megan, and Julia, who are able to offer virtual behavior modification sessions to our patients as well. Julie, in addition to being a trainer, is also a certified veterinary technician, and her passion is helping to teach pets how to cooperate for veterinary care. So there's a lot that we can do to help support you, whether it has to do with veterinary visits or another behavior concern. So if you would like more information, or if there's anything that we can do to help you, please feel free to reach out to us at the Animal Behavior Clinic. You can find more information at animalbehaviorclinic.net or by calling us at 503-236-7833. Take care.